Shoulder replacement is intended for people with arthritis of their shoulder, and it's generally indicated for those people that have failed what we would consider a round of conservative management. For most people, arthritis in the early stages or even the midway stages, when they still have pretty good function, can be managed with anti-inflammatories such as ibuprofen, Advil, Aleve, anything over the counter, or they can come in and periodically do a steroid injection. When they get to the point where they can't sleep at night, they can't lift their arm up without pain, they're taking narcotics, they're doing things that really are sort of compromising their quality of life, that's when I think shoulder replacement becomes a discussion that I'll have with the patient. The purpose of a shoulder replacement is to restore a smooth surface, smooth ball, smooth socket that you don't have anymore. The implants we use are made out of metal and plastic. So there's a metal ball with a metal stem, and there's a plastic socket that we will anchor into the bone that will help give that joint a smooth surface so that you can move without friction and without pain. Shoulder replacement in this day and age is done usually as an inpatient or an outpatient procedure even. Some of that's insurance dependent. Medicare will require at this point to stay overnight. The surgery takes about an hour to do. You are under general anesthetic, however the anesthesiologist will numb your arm up. That way, when you wake up, typically for about a 12 to 24-hour period, you really don't have a whole lot of pain. The patient population I'm doing this surgery on is usually in their 50s to as high as the mid-80s. Age really is not necessarily a deal breaker in terms of whether you can do the surgery or not. It's really an activity level and expectations of a quality of life. Once you become 75, 80 years old, there's a lot of people that remain more active than some 50 and 60-year-old patients that I've seen. My goal is to try to restore that quality of life and allow them to return to some of those things that they enjoyed previously doing. And so for me, to have something that I'm able to provide a patient that can make them better, that's really, that's one of the main reasons I went into what I do, orthopedics.